1,000 and above areas in the Andes Mountains in Peru. Homeopathy. There are specific homeopathic remedies, and what you can do, you can either go online or you can look up in a book. I think going online is great. And you can, or homeopathic doctor is actually always the best. But you can list a series of symptoms, and there's particular homeopathics that can match those symptoms depending on what your issues are with asthmatic attacks. I know in our stores we have one book that we can refer to and open up, and I can say, okay, what are your symptoms? What sounds the most like? I can go over to my homeopathic counter, pull off that homeopathic, they can take it under the tongue and get some relief. Very quick, fast remedy, and homeopathics are probably one of the most successful ways to deal with allergies as well. Go online and research a little bit more about homeopathy. It's been around longer than modern American medicine. How's that? Or actually, it was the first modern American medicine other than herbs. Pycnogenol, very, very anti-inflammatory. Actually, there was a recent article written by a physician about it being very effective. I know in my stores, I've sold almost a dozen pycnogenols just this last week for arthritis. But pycnogenol also helps with inflammation pertaining to asthma. Greens. We talked about greens in the diet, but there are some super green foods that you can intake. Spirulina, I'm going to say it right here, spirulina, chlorella. Anything that's a superfood green helps oxygenate. We use this for COPD patients, asthma. If people aren't good vegetable green eaters, come in, you can grab them in pill form, you can grab them in powder form, whatever it is. But these super greens alkali the blood and they oxygenate so that you can breathe better. And if you're an athlete like I am, you can perform better and breathe better. I used to have a little bronchial dilator. Absolutely, and so did my younger son. And when I would go out on my athletic events, particularly climbing, I lived in Phoenix at the time, my inhaler went with me until I learned these key tips about reducing my asthmatic response and alkaline the blood. Super greens, simple, easy, food sources. You can mix them outright, take them in pills. But if I have to stress anything, get your vegetables, alkali your blood, look at your diet. I'm hoping this gave you some good basic information on what to address for asthma. Research some more on your own, and like I said, there was tons more research. I could have spent a couple hours on this lecture, but hey, I only got 19 or 20 minutes. So anyway, we're going to be moving on to the next portion of our show, which is the fitness portion. Thank you. Hi, welcome to the fitness portion of our show. And today, rather than moving and grooving, I want to talk a little bit about diet and the timing of eating when you're trying or starting a weight loss program. Number one, don't eat carbohydrates late at night. So, a good protein with a salad, otherwise your body doesn't have time to use those calories. Second tip, spread out your meals, 300 to 400 calories at a meal, 5 meals, nice small meals. That way all you're going to do is you're going to fill your liver glycogen supply up and you're not going to store it as fat. That was the second tip. Third tip, when you eat food, eat a balance of proteins, carbohydrates, and fats. And boy, I sure hope maybe I have to do a definition of carbohydrates. It's sugar, white flour, pasta, starches. Vegetables are the good source of, and fruits are the good sources of carbohydrates. So for example, a sample breakfast, a nice small bowl of oatmeal, a couple of scrambled eggs, okay, with maybe some, a couple of nuts or a little bit of nuts, almonds on the side. So we've got fats, proteins, and carbohydrates. A lunch might be an open-faced sandwich with meat, avocados, that type of thing, to where basically you can get a good balance of food, but not an overabundance of calories. And then a dinner, a nice dinner, some source of protein with like a nice salad. And then some snacks in between, like nuts and fruits, a combination like that, or a protein shake. Spread out your meals. Don't eat carbs late at night. If I could give you any hint as far as diet is concerned, those would be the biggest hints to help you drop off the weight. Next, we're going to be moving on to the research portion of our show. Thank you. Hi, welcome to the research portion of our show, and with us today is Ralph Turchiano. Ralph?
And thank you for the intro. Well, here it goes again. Another interesting food item that seems to be extremely effective against serious diseases such as leukemia. Now, this food item is already tested to be effective against cancer cell lines in skin, breast, colon, lung, stomach, and prostate cancer. This supplement or food item was grape seed extract. Not grapefruit, but not grapefruit, but grape seed. In fact, this study that just came out of the University of Kentucky, they found that within 24 hours, 76% of leukemia cells had died after being exposed to the extract. How did they die? They died through a process called apoptosis, meaning the cells just basically committed suicide. In addition to that, they found that it worked with regulating a protein called JNK. If you want to research it, just remember junk, take the U out. They also discovered, too, that what they were looking for is an agent that was effective on cancer cells but leaves normal cells alone. And this shows that grape seed extract fits that criteria. In addition, did they use any special form of grape seed extract or any sort of medically filtered pharmaceutical grade? No. They use commercially available grapeseed extract, which you can find in the market or just about any health food store. And they said, too, it does not affect normal cells, which is a plus. They don't know why that happens, but it does not. After that, a good strong one for antioxidants. Now, your antioxidants like vitamin C and vitamin E and vitamin A that sometimes get some bad press. But however, in this case, they found when it came to chronic pancreatitis, which there is no known medication to relieve the pain from chronic pancreatitis, otherwise known as CP, they found it was effective at reducing that pain and reducing the levels of oxidative stress in patients with chronic pancreatitis. This was in the new study of gastroenterology, just as far as what's out there. In fact, it was twice the rate over just placebo, or just mind power alone. Furthermore, 32% of the patients after 3 months with chronic pancreatitis taking antioxidants became totally pain-free. They basically also said, too, as a side note of how it worked, the fact that measures of oxidative stress will actually increase slightly after taking the antioxidants, then decrease significantly afterwards. They suggest that this state of heightened free radical mediated injury in chronic pancreatitis that basically prevented also gave the opportunity that maybe that this injury is reversible. Again, this came out of the Journal of Gastroenterology and also reported in the Journal of American Gastroenterological Association Institute, otherwise known as AGA. I just wanted to get that information because it's important. AGA. After this, diabetes, Atkins. Remember when they shot him down for a long period of time and trying to recommend low-carb diets for diabetic patients? Well, Duke University Medical Center researchers found out the low-carb worked very well. In fact, this is what they discovered. They said, quote, "We found you can get a 3-fold improvement in type 2 diabetes as evidenced by a standard test of the amount of sugar in the blood." Now, ready for this? That wasn't the good part. The good part was this. Diabetic medications were reduced or eliminated in 20, 30, 40, 50, 60%? No, eliminated in 95% of the low carbohydrate volunteers, compared to 62% just doing low glycemic index. The low carbohydrate diet also resulted in greater reduction in weight. That's a strong plus for the low carbohydrate diet. It is not just about calories when it comes to diabetes. It is about how that food treats the pancreas and causes that production of insulin or your sugars to go up. Low carb proves that there's a correlation between your diet and that disease. Now we go back to the attack phase. Now, a long time ago, we've been very much adamantly against some of these biophosphonates. These biophosphonates often go by the name of things like Fosamax, Simboniva, and other type of medications like that. Reason being, because we really haven't seen any credible scientific reason for its use. Now here's another reason to basically question it or bring it up to your doctor. University of Southern California School of Dentistry, and also reported in the Journal of American Dental Association, otherwise known as JADA. And also, too, keep in mind Fosamax is the 21st most prescribed drug in the world. They found out that a small percentage of patients, 9 out of 10, taking the oral form of biophosphonates, the ones you take by mouth, for any length of time, developed osteonecrosis, meaning your jawbone begins to melt away. So the way they said basically, we have been told that the risk of oral biophosphonates is negligible, but 4% of the people taking it just after any length of time is not negligible, he said. So most doctors who prescribe biophosphonates have not told patients about any oral health risk associated with the use of these drugs, despite even short-term usage opposing a risk due to the drug's tenacious 10-year half-life in bone tissue, meaning 10-year half-life after taking Fosamax for a short period of time, staying in your body. And patients that developed necrosis after going off, it took as long as a year to heal. Real important, special for dentistry, and beginning to voice concerns from the other side of the aisle. After that, number 5, vaccine policy. Sometimes what happens, it needs to be challenged from time to time. Well, the researchers in Switzerland and the United Kingdom did, especially to the pneumonia vaccine. When they looked at 22 clinical trials with 100,000 participants in North America, India, Africa, Latin America, and in the Caribbean, when they looked at the high-quality trials, they said, quote, there is no evidence that the pneumonia vaccine can prevent pneumonia. Therefore, policymakers may therefore want to reconsider their current recommendations for that vaccine, especially where routine pneumococcal conjugated immunization has been introduced, concluded Dr. Matthias Egger, the University of Bern of Switzerland, and their co-authors. Something to really consider, especially when it comes to vaccines. Why endure the risk with zero benefit, regardless of public policy or propaganda issues? After that, we go to the serious condition of autism in the state of California. Researchers at UC Davis often were told that the only reason autism rates are increasing in the state of California is either 1, by immigration, or 2, better diagnosis, or 3, the inclusion of more milder forms of autism in basically these studies. Well, they discovered, it's also published in the January 2009 issue of Journal of Epidemiology, that that is not the case. They said it is time to start looking at the environmental culprits responsible for the remarkable increase in autism in the rate of California. We're talking basically multiple cases where it used to be 9 in 10,000, now to 44 in 10,000. What they're pleading for is financial aid and looking at the environmental reasons. They say all the money is going to genetic reasons, when in reality they know now it's environmental and they need to rechange that funding around. Well, thank you very much.
Gosh. Wow, thank you very much, Ralph. It's very, very appreciated. Thank you very much for joining our show, and we hope once again that this helps encourage you to do further research for yourself and for your health. Thank you.